Hi everyone, I am Miss Deepika, Assistant Professor from the Department of Nutrition and Dietetics from St.Josephs College of Arts and Science for Women, Huzur. Here we are going to discuss about obesity. Introduction. Obesity is a complex medical condition that has become a significant global health concern in recent decades. It is characterized by an excess accumulation of body fat, which can have detrimental effects on health and overall well being. Obesity is typically assessed using body mass index, which is called BMI, a measure calculated by dividing an individual's weight in kilograms by the square of their height in meters. Obesity arises from a combination of genetic, environmental, and behavioral factors. Excessive calorie intake, sedentary lifestyle, genetic predisposition, socioeconomic factors, and hormonal influences all play a role in the development of obesity. In many cases, obesity results from an imbalance between energy intake, that is, calories consumed, and energy expenditure, that is, calories burned. Causes. Genetics. Genetic factors can predispose individuals to obesity by influencing metabolism, fat storage, and appetite regulation. Some people may be more genetically susceptible to weight gain than others, making it easier for them to become obese in environments with abundant food availability. Environmental factors. The modern environment, characterized by easy access to high calorie, processed food, and sedentary lifestyles, promotes weight gain. Factors such as food advertising, portion size, built environments that discourage physical activity. For example, lack of sidewalks and unsafe neighborhoods, and the prevalence of food deserts, that is, areas with limited access to affordable and nutritious food, contribute to obesity. Dietary habits. Consuming a diet high in calories, processed foods, added sugars, and unhealthy fats contributes to weight gain and obesity. Overconsumption of sugar beverages, fast food, fried foods, snacks, and desserts can lead to excessive calorie intake and weight gain over time. Physical inactivity. Sedentary lifestyles characterized by low levels of physical activity and prolonged periods of sitting on screen time are significant contributors to obesity. Lack of regular exercise reduces energy expenditure and promotes weight gain, especially when combined with excessive calorie intake. Socioeconomic factors. Socioeconomic status can influence obesity risk, with lower income individuals and communities facing higher rates of obesity due to factors such as limited access to healthy foods, higher price for nutritious options, and fewer opportunities for physical activity. Psychological factors. Emotional factors such as stress, depression, anxiety, and boredom can trigger overeating or unhealthy eating habits, leading to weight gain and obesity. Food may be used as a coping mechanism to deal with negative emotions or as a source of pleasure and comfort. Medical conditions. Certain medical conditions and medications can contribute to weight gain and obesity. For example, include hypothyroidism, polycystic ovary syndrome, which is called PCOS, Cushing's syndrome, and certain antidepressant, antipsychotic, and corticosteroids. Sleep deprivation. Inadequate sleep or poor sleep quality can disturb hormonal balance, leading to increased appetite, craving for high calorie foods, and reduced energy expenditure. Chronic sleep deprivation is associated with weight gain and obesity over time. Symptoms. Increased body weight. Obesity is defined by an excess accumulation of body fat, often resulting in a higher than average body weight for a given height. Body mass index BMI. A BMI of 30 or above is considered indicative of obesity. BMI is calculated by dividing a person's weight in kilograms by the square of the height in meters. Excessive fat accumulation. Obesity is characterized by an excessive amount of body fat, particularly around the abdomen, hips, thighs, and buttocks. Difficulty in breathing. Excess weight can put pressure on the chest and lungs, leading to shortness of breath or difficulty in breathing, especially during physical activity or when lying down. Joint pain. Obesity increases the risk of musculoskeletal problems such as osteoarthritis, as excess weight puts strain on the joints, particularly the knees, hips, and lower back, leading to pain and stiffness. Fatigue. Carrying excess weight can lead to feeling of fatigue or low energy levels, as the body may need to work harder to perform daily activities. Insulin resistance. Obesity is associated with insulin resistance, a condition in which cells fail to respond effectively to insulin, leading to elevated blood sugar levels and an increased risk of type 2 diabetes. High blood pressure. Obesity is a significant risk factor for hypertension, that is, high blood pressure, which can lead to cardiovascular disease, stroke, and kidney problems. Abnormal blood lipid levels. Obesity is often associated with dyslipidemia, characterized by high level of LDL cholesterol, that is bad cholesterol, and triglycerides, and low levels of HDL cholesterol, that is low cholesterol, increasing the risk of heart disease and stroke. Sleep apnea. Obesity is a common risk factor for obstructive sleep apnea, a condition characterized by interrupted breathing during sleep, leading to daytime fatigue, poor concentration, and an increased risk of cardiovascular problems. Digestive issue. Obesity can increase the risk of gastroesophageal reflux disease, that is GERD, fatty liver disease, gallstone, and other digestive disorders. Guidelines for obesity. Set realistic goals. Establish achievable and sustainable goals for weight loss and overall health improvement. It aims for gradual weight loss, typically 1 to 2 pounds per week, to promote long term success. Consult with healthcare professionals. Before starting any weight loss program, consult with the healthcare providers such as a doctor, registered dietitian, or obesity specialist to assess your health status. Identify any underlying medical conditions and receive personalized recommendations. Adopt a healthy eating plan. Focus on a balanced diet that includes a variety of nutrient rich foods such as fruits, vegetables, whole grains, lean proteins, and healthy fats. Monitor portion size, limit intake of processed and high calorie foods, and practice mindful eating. Control portion size. Pay attention to portion size to avoid overeating and use techniques such as measuring food portion, using smaller plates, and avoiding eating straight from the packet. Increased physical activity. Incorporate regular physical activity into your daily routine to burn calories, improve fitness, and support weight loss. Aim for at least 150 minutes of moderate intensity anaerobic activity or 75 minutes of vigorous intensity activity each week, along with muscle strengthening activity on 2 or more days per week. Find activities you enjoy. Choose activities that you enjoy and can sustain over the long term, whether it's walking, swimming, cycling, dancing, or participating in group fitness classes. Experiment with different types of exercise until you find what works best for you. Gradually increase activity levels. Start with manageable amounts of physical activity and gradually increase duration, intensity, and frequency over time to avoid injury and burnouts. Set realistic expectations. Understand that weight loss takes time and consistency. Focus on making gradual, sustainable changes on your diet and lifestyle rather than seeking quick fixes or extreme measures. Address emotional eating. Learn to identify triggers for emotional eating and develop alternative coping strategies, such as practicing mindfulness, engaging in relaxation techniques, seeking support from friends or a therapist, or finding happy and healthy ways to manage stress. Build a support network. Surround yourself with supportive friends, family members, or peers who can encourage and motivate you on your weight loss journey. Consider joining a support group or enlisting the help of a weight loss coach for adding accountability and guidance. Monitor progress and adjust as needed. Keep track of your weight, dietary habits, physical activity, and progress towards your goals. Adjust your plans as needed based on your results and feedback from healthcare professionals. Stay committed and persistent. Stay committed to your weight loss goals even when faced with setbacks or challenges. Focus on the positive changes you are making for your health and well being and celebrate your success along the way. Thank you.